In a world, actually, never mind, in the United States of America. In May 2000, 4 cattle died on a ranch in North Dakota. 2 months later, July 6th through September 24th, 157 animals died on 31 different farms. 62 people were involved in animal processing, care, and carcass disposal. On August 5th, 2000, a 67-year-old North Dakota male resident visited a primary care physician. He had a quarter-sized lesion surrounded by a black scab near his jaw. Patient had no signs of illness. He was sent home with antibiotics. 3 days later, the patient was back again. His black scab and lesion enlarged. Sample of infected area was taken. Gram stain resulted in positive capsule-containing chains of bacteria. Fluorescence showed evidence of endospores. Upon further questioning 4 days prior to his doctor's visit, he participated in animal carcass disposal on a North Dakota farm.
The disease anthrax, derived from the microorganism Bacillus anthracis, is a historic pathogenic organism, also known as the fifth plague in the Book of Genesis. Bacillus anthracis is a large, gram-positive, aerobic, catalyst-positive, non-motile, carbon and nitrogen-utilizing capsule and endospore containing inhabitant of the soil. Known for its abundant virulence, upon unfavorable environmental conditions such as low or high pH and temperature levels, drought, or high nitrogen levels, this organism is able to dehydrate itself, creating thick spore wall, inner cortex, and a membrane known as an endospore. Under favorable environmental conditions, such as 37 degrees Celsius, abundant amino acids, pH levels around 7, and high glucose levels, this organism is able to multiply freely, creating vegetative capsule and toxin-containing cells. The organism capsule, also known as a glycolysis, is a thick layer surrounding the cell composed of chains of amino acids called polypeptides. This allows the organism to protect against phagocytosis, allowing multiplication and growth to be unimpeded. Once the organism has created vegetative cells, it is also able to produce toxins. Protective antigen toxin, also called PT, combines with edema factor, creating edema toxin, also known as ET, and lethal factor, creating lethal toxin, known as LT. Upon germination in a species, PT attaches to the cell's surface receptor, creating a channel in which LT and ET can enter. Once ET and LT has entered the cell, ET causes excessive swelling and fluid, whereas LT can cause death to the cell. As a result, fever, cough, lesions, and large black scabs, as well as shortness of breath are symptoms, further causing symptoms of meningitis, hypotension, extreme fluid in pleural cavities, and renal and liver dysfunction. Now let's talk about where Bacillus anthracis is found. Bacillus anthracis is a worldwide disease. However, it is most prevalent in developing countries such as Central, South America, Sub-Saharan Africa, Caribbean, Central and Southwestern Asia, and Southern and Eastern Europe, where immunization is less common. The organism pathogenicity is typically through livestock animals, in which they become infected through inhaling or ingesting or intrusion upon lesion from endospores. Humans become infected upon infected animal carcass disposal, processing of specimen, and handling infected animal products. Let's now talk about the different ways that you can be infected with anthrax. 5% of cases known are due to inhalation anthrax, also the most serious. Upon entering the respiratory system, the organism within days can create extreme respiratory distress. Within 24 hours, if not treated, the patient can die. Among 95% of the cases are cutaneous anthrax, in which the spores enter through a cut in the skin. Within 1 to 2 days, a bump-filled edema forms due to the ET, and a black, large scab forms due to the LT. If left untreated, organism can rapidly spread to the blood, multiplying, concluding in death. Less than 1% of the known cases are due to gastrointestinal anthrax, in which improperly cooked infected meat is ingested. Severe swelling of the intestines, bloody diarrhea, and nausea are symptoms. If not treated, it can enter the blood, further resulting in death. Hey, so are you going to go to Kevin's party tomorrow night?
I don't know. I'm not really feeling that good.
Really? What's wrong?
My stomach's been hurting really bad. I don't know. Maybe it's something I ate.
Are you okay?
I've been throwing up and I have diarrhea.
Upon early stages of infection, treatment includes ciprofloxacin and penicillin G combined with streptomycin and gentamicin. Upon treating with ciprofloxacin, B-lactam resistance may occur, in which the organism contains enzyme B-lactamase, which inhibits the B-lactam ring from synthesizing the bacteria's cell wall. This correlates to the case study talked about previously when the male was given antibiotics and his infection persisted. Among more severe infections and B-lactam resistant cases, 3 antimicrobial drugs can be used together: a protein synthesizer such as linezolid, CNS penetration drugs such as clindamycin, and bactericidal drugs such as ciprofloxacin. An antitoxin such as anthrax immune globulin, also known as AIG, has been recently used to treat systematic diseases when combined with usage of antibiotics. AIG works by disassociating the PA toxins, further inhibiting LT and ET to enter the cell. This drug is under further examination, and let's take a look at a recent case study when this drug was used.
In Minnesota, 2001, a 67-year-old male with a history of high blood pressure, prediabetes, and inflammation of the lungs due to chemical pneumonitis was hospitalized. He had a fever, cough, diminished renal functioning, hypotension, and shortness of breath. Prior to being sick, the male traveled to western parts of the United States, where he was affiliated with donkeys, wild bison, antlers, and hides.
So, it says here you're 67 years old. Is that correct?
Uh-huh.
All right. Let's do some further examination. Can you please move forward for me? Breathe in. Very shallow breathing. I hear some fluid back there. All right, I'm going to administer these drugs through your IV. How are you feeling?
Oh, hurting.
Okay. I'm going to now administer the anthrax immune globulin. Breathing seems to be between normal ranges. How are you feeling?
I feel a little bit better, Doc.
Great. I'm going to take some further tests and see how your levels are getting back and see what this drug has done for you. All right? As seen in the video, patient was given ciprofloxacin, clindamycin, and rifampin as the 3-dose regimen, and pleural cavities were also drained. Upon day 5, antitoxin anthrax immune globulin was given, and on day 6, renal functioning, leukocytes, and salt levels were resolved. On day 26, patient was released and given a 60-day ciprofloxacin oral prescription. According to this case study, AIG created 8 anti-PA serum levels, allowing the antibiotics to penetrate the pathogenic cells, resulting in patient recovery. Let's conclude today by looking at measures that we can take to prevent contamination of anthrax. Let's leap back in 1881 when Pasteur contaminated broth with anthrax, in which he placed them at 42 degrees Celsius and 52 degrees Celsius for months. These organisms became non-virulent, and when injected into sheep, they showed immunization. Today, immunizations for anthrax can and should be given to all livestock animals and people associated with animals. Also, simple measures can be used to reduce contamination, such as aseptic techniques, as well as cooking meat properly, wearing clothing with maximum coverage, and wearing gloves. Before disposing of carcasses, they should be submitted into oxidizing agents, such as ethanol oxide, for long periods of time. They also can be autoclaved.